Hi, this is Dr. Kelly from Peach Valley Dental. I'm here with my hygienist, Safiyah.
Hi.
And we're here today to answer one of the questions that is most asked prior to people making their appointments. And that is,
how often should I get my teeth cleaned? Well, would you like to go first? I'll go first. Well, for a healthy mouth, we recommend you have your teeth cleaned and examined every 6 months. That includes usually a review of your medical history, any updates, changes, hospitalizations, allergies that you've come up with recently.
New medications,
anything new that we don't know, or if it's your first time, anything new that we need to know, because your teeth and your body are connected. So we need to know everything about you.
And we'll take x-rays. Because we're very limited and we know our limitations. We're really good, but we can't see in between teeth. And the x-rays help us to identify things that we can't see with our eyes.
Like cavities, bone loss, any
debris that is heavy on the teeth.
Also called tartar or calculus.
And at that point, we will sit down, examine your teeth and tissues. I'm the teeth person, she's a tissue girl. So, as I look at the teeth, I'm looking for areas of decay, any broken, fractured, or missing teeth. And what I do is make a treatment plan regarding the replacement, the restoration that will be required for those teeth. Safiyah's job is...
Well, first we start off usually with probing. You've probably heard people call out numbers while before they start cleaning your teeth. 1, 3, 3, 2, 5, 6. So those numbers are to help us evaluate the health of your gums. After we evaluate the health of your gums, then we either proceed with a regular cleaning if your numbers are between 1 and 3. And if they're above 4, then we will do a different kind of cleaning. But we're talking about healthy mouths here. So we'll proceed with a regular cleaning. We use a Cavitron that uses water and ultrasonic vibrations. We use hand scalers, those silver instruments that people think are
sharp weapons. But they're not.
They're sharp, but they're just sharp for your teeth. Nothing else. And we use that. We use polish. Sometimes we use air and water to remove stain. We floss.
We teach you new hygiene habits if you've been slacking on some of the areas. And we let you know how you can do things better. The goal of this is to help you be better.
Now, the big question that everybody wants to know, does it hurt? Usually it doesn't hurt. Sometimes there's a little bit of discomfort. If you haven't been in a while, you may have some inflammation in your gums. It may make it a little uncomfortable, but usually it's comfortable.
It's like a spa for your mouth.
Does your insurance cover it? Do you have insurance? Okay, if you have insurance, 9 times out of 10, they cover it at 100%, usually. And you usually get 2 per year. Sometimes insurance varies, but I would go with that. 2 cleanings per year, covered at 100%. So you don't have to worry about any, do I have to pay a copay or how much money I have to pay. You don't have to worry about any of that initially.
And here at Peach Valley, if you have insurance that is dental, we provide the service of verifying your coverage exactly what it is, so that you will know prior to getting in the chair what your responsibility, if any, it will be.
Okay. And if you don't have insurance, we have a few plans to help you out.
We have a $99 special.
Yes.
Which includes an exam and 4 diagnostic x-rays and a cleaning if you have no other signs and symptoms of disease. So, this is Dr. Kelly from Peach Valley Dental and my hefty sidekick,
I'm Safiyah,
the hygienist, and we wish you healthy smiles.
Come check us out.